He is everywhere. Dr. Gary Norsworthy is at veterinary clinics all over the country, all over the world, I believe. Right?
Yes.
Yes, he says, talking to veterinarians. Also has a feline specialty practice of his own, has done research himself. And you know what, Dr. Norsworthy? I'm mad as H-E-double, you know what, because cats are not seeing the veterinarian. Fairly new numbers from the American Veterinary Medical Association suggest on average, including all cats, including very old, very sick cats who probably go several times a year to the vet, we hope, cats overall are visiting the veterinarian less than once a year. That's shocking to me. 0.7, I believe. The result to me is that cats are not getting, the good news is they're living longer overall because you can do more, better nutrition when people do see the veterinarian. But boy, we could be and should be doing so much better.
And what's really shocking to me is this 0.7 visits per year is less than it was 20 years ago. It went up, and now it's come back down.
Why do you think?
Honestly, I think a lot of it has to do with the change in our vaccine protocols. Many practitioners have adopted a protocol where they believe the cat needs to come in every 3 years, which means
But
that...
how about wellness exams?
Well, the client perceives that if vaccines are not needed but every 3 years, then that's all that's needed.
But maybe they're not needed, but we need to, yeah. I mean, just like you and I go to the doctor maybe once a year, we're guys, so we might not. We might go every 3 years. But not taking your cat once a year is about akin to you not going to your doctor once every 6 or 7 or 8 years.
That's correct.
That's not good.
And that's the tragedy of the thing, is that cats age so much faster than we do that going every 2 or 3 years is a tremendous number of years in human years. So the cat really gets neglected.
All right, so instead of complaining about it, let's turn this all around.
Okay.
For the person who sees you, your client, twice a year, which is my ideal, you're typically, one would think, healthy cat. Do you catch illness? Can you think of an instance in your head that you've caught, and I bet you can think of many, because any veterinarian can, and you're shaking your head, oh yeah.
Oh yeah.
Yeah, where you can, and ultimately save a cat's life as a result. Just like in people, you catch something early, you can make a difference.
Absolutely. And I guess the older cat is the one that is most in need of semi-annual visits, because there are a number of diseases that occur as the cat ages. And we recommend blood profiles once or twice a year. With those blood profiles, we'll find early kidney disease. We'll find early thyroid disease. With my physical exam, I am always palpating the thyroid for enlargement as a sign of early thyroid disease, listening to the heart, listening for murmurs, abnormal rhythms. I pick up lots of heart disease. My annual physical exam includes an EKG.
Good. Do you do blood pressure as well?
Blood pressure is a little bit optional. As the cat gets older, yes. But blood pressure in the cat is a little more involved than it is for you and I. Yeah. It'll take a good 15 minutes to do it properly in the cat because they're so subject to stress and the blood pressures go up and you get numbers that are not meaningful.
Right.
But as the cat gets older, that becomes more and more of an issue. Thyroid disease and kidney disease both are associated with high blood pressure.
Do you catch cancers early on?
Oh yes, we catch lots of lumps, various places, many times.
A difference between catching all that early in quality of life, I imagine, but I imagine even life. I imagine that you save lives of clients who come in twice a year as opposed to a client who says, my animal seems fine, but you know what, Dr. Norsworthy? I don't know any client who can do blood work at home. I mean, how can they really tell?
Right. I think of a cat that I saw within the last 2 weeks that came in because it had a little lump, and as we were shaving the hair off to do the surgery to remove that little lump, we found a second lump. Now the first one turned out to be benign. The second one was an adenocarcinoma. We saved that cat's life by finding it when it was very small.
And I bet you have lots of examples like that.
Oh yes.
So are you a proponent, as I am by the way, on average of seeing a veterinarian twice a year for any dog or cat?
Yes, absolutely. I think we best serve our clients and our patients by really strongly recommending twice a year visits.
National Pet Wellness, I'm all about it. You are too. Thank you very much, Dr. Gary Norsworthy.
You're very welcome. Thank you.